All right. Good afternoon, everyone, and welcome to HireRight's webinar for the new standard for safe and compliant healthcare hiring. My name is Joe Connerty. I'm going to be your host and one of the speakers for today's session. And I do want to just quickly go over a few housekeeping items with you before we get started. First off, if you are experiencing any audio or visual issues, please refresh your browser or press on the F5 key on your keyboard. We will be sending your HRCI and SHRM credit information by email tomorrow, along with the link to this recorded session. We will not be providing copies of today's slides, but you can rewatch the recording at any point once you get that link. And lastly, after the presentation, we would appreciate getting your feedback. So please take a minute to complete the short survey at the end of our presentation and Q&A session today. A quick legal notice just before we dive into things here. HireRight and Verisys prepared this presentation for information purposes only and is not intended to be substitutes for legal advice. Should you have any questions, please direct them to your legal counsel. All right, so let's go ahead and get some introductions here. Then we'll go into the agenda. My name is Joe Connerty. Like I mentioned, I'm on the strategic enterprise team here at HireRight. Been in the industry for about 13 years now. I do have a Six Sigma Green Belt certification as I work with different clients on improving their processes. And while I've had the pleasure of working with all kinds of organizations in a lot of different industries, my specialty is really in working with large healthcare organizations who are looking to improve their pre-boarding or onboarding program, especially as it relates to background screening, drug and alcohol health, employee health, and things like that. Nicole, you want to go ahead and give a quick introduction?
Thanks, Joe. Hi, my name is Nicole Berryman. I am our Senior Vice President over Sales and Partnerships at Verisys. I've been with Verisys for about 15 months, so I'm still newer to the organization. I came from the background screening space where I was for a collective amount of about 15 years, so I've sold the Verisys product for a very long time. Thank you all for being here. We are excited about doing this healthcare compliance webinar, and I appreciate the opportunity to co-present with Joe.
Great, thank you, Nicole. And before we go over the agenda, I do also want to thank Nicole and the Verisys team for supporting the webinar today and the great partnership we have with them. We do have a long-standing relationship with Verisys, where HireRight's able to offer several products supported by data from Verisys that are designed to help our clients in the healthcare industry. These include pre- and post-hire sanction and license checks that support employer compliance in connection with screening their employees, their vendors, and their contractors. So again, thank you, Nicole and Verisys, for joining us in today's conversation. Now, with the agenda, we're going to go over some emerging threats when verifying identity for your candidates, some gaps in your hiring program that may put you at risk if you don't address them, some HireRight products that are going to help detect signs of fraud. That's going to be mostly focused on verifications, and licenses, certifications, things like that. And then we're going to wrap up with some best practices around post-hire screening and monitoring before we head into the Q&A portion of the meeting today. So if you do have any questions as we're going through the presentation, please feel free to put those in the chat, and we'll be sure to address them at the end of the webinar. Now, before we dive into that first item on the agenda, I kind of want to set the stage here as far as the challenges most clients experience when hiring in healthcare. First, identity and credential risk are front and center. With recent stories of individuals faking both their identity and their credentials, organizations are really under pressure to ensure that their screening and onboarding programs can quickly and accurately verify who someone is and whether they're qualified or not for that position. So that's a major focus and one of the first things we're going to get into in today's discussion. As we look at these other items, we also know that healthcare screening is incredibly complex, especially for organizations operating across multiple states and different care settings. That complexity can often slow things down and increase that compliance risk when you have to comply with all these different regulations in the different areas you're working. Post-hire, most organizations really just do enough to meet the federal requirements, but we're going to talk a bit today about some great options to strengthen that program and better protect your patients and your brand with those post-hire monitoring and rescreening tools. And the last piece here, really it all comes down to and totals in this reputational exposure. And we want to make sure we're not thinking about just who's on staff today, but in the future, if something happens and you have to terminate someone because of fraudulent credentials or something happening post-hire that wasn't picked up, it can resurface and raise questions, especially in high trust environments like healthcare. So we'll be going over some items today to help protect your brand reputation. So with that, we're going to get into the first item on the agenda here, which is verifying identity. Identity really is becoming a much bigger issue across the board. We are seeing more cases where people aren't who they say they are, whether it's fake names, stolen credentials, or both. And really, it's not slowing down. Last year, compared to 2023, there was a 50% increase in identity theft reports. So that's only accelerating with the growth and the improved kind of skill and talent of the AI tools out there and folks using them. It's something that we really need to make sure we are addressing as part of our screening programs. So that's really why identity checks matter. They help you catch fraud early, before someone gets in the door, and it helps lay the groundwork for everything else in the screening process. At this point, it's really not just a best practice. It's essential for most organizations to have this kind of identity check in place. Now, there are a few different ways to review your candidate's identity information. You can see 3 of the most common items here on the screen: SSN trace, SSN verification, and then ID check and biometrics. So first off, the SSN trace, most folks are going to be familiar with that. It's pretty much a staple in any background check package in the US. The real core of it, what it's used for or should be used for, is a locator tool or a pointer tool to help spin up public record sources that are going to be relevant based on where that person has lived. You can also pull up potential alias names or AKAs that someone has used in the past, name changes, things like that, so that we are pulling in additional information to search for records on that individual. Now, some organizations have used this kind of as an identity confirmation to see if the information provided in the candidate's experience when they're providing their name, social, and date of birth, does that match what shows up on the trace? Now, it really shouldn't be used that way. It's on a verified data source. It is a database that could have incorrect information. So you really want to make sure it's really just being used to identify areas to conduct those public record searches. The second piece here is the SSN verification. This is different in that it's not just a database source. This is going directly to the SSA, the Social Security Administration, to confirm that the name, date of birth, and social security number provided by that candidate or that subject matches what's on file with the SSA. So that confirms that it was issued to this person or to a person with this set of data, but it does not confirm that the person providing that information is that person. Say Jane Doe provides the social security number and date of birth, and it comes back from the SSA that does belong to Jane Doe, but we haven't confirmed that the candidate is actually Jane Doe with this service. Just confirms that it is a correct SSN with the correct details. The third item on here is ID and biometrics. So there's really 2 phases to this. The biometrics piece is a bit newer as far as an offering in the industry, but an ID check confirms the validity first of an ID document. Then with the services we offer now, it uses biometrics to confirm liveness. So it does a selfie video to confirm liveness of that individual, and then a biometric scan to confirm that the document provided and the picture on that matches the person that is doing the selfie right there in the applicant process. So that's going to confirm not only the liveness, but the match between those documents and confirm that the person entering the information is the person who's providing that information. So this is most common and most relevant for companies that are going to be hiring folks that are going to be fully remote. Because if you do meet someone in person, that's where you're going to be able to do the in-person confirmation of those documents, you're going to be going through the I-9, typically doing e-verify and confirming that information. But if it's going to be fully remote, then this ID and biometrics service is really going to help confirm that identity. And one article I actually saw last week had a few interesting stats. I saw it on Becker's Hospital Review. Currently in the healthcare industry, 12.7% of high-paying jobs, those making over $100,000 a year, are available as fully remote. It's actually up almost 30% from the first quarter of the year, so it's not slowing down. In healthcare, it's becoming more important to verify this, verify identity, especially as more people are going to be going for those higher paying jobs. Want to make sure that you know who is going to be coming into the organization. All right, and I just wanted to give a quick overview. Can probably read this quicker than I can say it to you, but this is one of the ways you can do that. This is an example of what one of those global ID searches looks like. This includes both the liveness check and the confirmation of the validity of that document. We call it the global ID check because it's not limited to just US documents. It does support all international documents that someone may provide, whether it be a passport or other government ID, so that wherever your candidates are coming from, we can confirm not only the document, but that it matches the person that is providing it. So that goes through the first section of the agenda here today. I am going to be passing this over to Nicole to take us through some of the potential gaps in the hiring program, and then I'll be coming back in just a few minutes.
Thank you, Joe. I was able to give a quick introduction on who I am, but I really wanted to explain who Verisys is. With Verisys, we work directly with clients, or we work through partners like HireRight. With HireRight, you would see that they are the front end platform with the Verisys healthcare data pumping in behind it and feeding it. So to talk about Verisys as a whole, we have two different sides of our organization. About 4 years ago, we went through a merger. Our credentialing side of the business, which is Legacy Aperture, merged with Verisys, which is the data and monitoring side of the organization. So 4 years we came together, but we have two different sides of the business. We are one of the largest credentialing organizations. We do credentialing and re-credentialing, and then we also do data and monitoring. We've been in business for over 30 years, and we work directly with certain markets. So if you see Verisys out there in the healthcare space, we have different markets that we sell into. Health plans is one of them, with insurance and payers up underneath that. We have health systems, so like large healthcare organizations, behavioral health, telehealth, mental health. And then you look at pharma, pharmacy, and life sciences. And then we also have healthcare technology. So if you look at HireRight, they're that platform again with our data pumping in behind it. And then we also integrate and partner with some of our top competitors in the space to where we're the data behind their platform. And then we also integrate with some applicant tracking systems and HRIS systems. So I just wanted to give that quick overview of who Verisys is in case you didn't know, because a lot of the times we're behind the scenes. I want to talk about compliance as this pyramid right here. And the way that I like to think about it is you have your good, your better, and your best. So first I'll relate it to background screening because that's where a lot of us are the most familiar with. So if you look at this pyramid of compliance, that bottom layer right there, I would say would be equivalent to running a national criminal database in the background screening world. That checks the box. It's something that encompasses the nation. If you wanted to get more granular and instead of just doing the good and you want to do the better, which is that middle layer there, that would be more like adding in on top of your national criminal search to add in a federal or a state search. And then that top layer, which is the best practice in the background screening space, is a county criminal search. That's the most primary source. That's where the records are housed at. That's where you really want to be going. But together, they make that triangle. So now I'll relate it over to healthcare screening. If you look at it, again, the good, better, best, that bottom layer is really just meeting the regulatory compliance. So if you look at it in the aspect of sanctions, that would just be just running an OIG or a GSA search. Then if you look at the better solution there, that's where you're adhering to standard setting organizations like NCQA, URAC, or Joint Commission. Some of our competitors or homegrown solutions that background screeners offer are within that space as well. Where Verisys really differentiates is that top layer right there. So not only do we adhere to NCQA, URAC, and Joint Commission standards, but we're also giving you real-time information that's hire-or-fire decisions. So that's real-time data that's directly integrated with the primary sources that you can make decisions based upon. To go over here to this next slide, there's a few different sections that I wanted to focus on. Today, we'll be talking a lot about sanctions, licenses, and then monitoring of sanctions and licenses. So that first box right there is where we come in with 40% more actionable data compared to what other solutions are out there. So if you break it out, the different solutions to where you would see Verisys within the space when it comes to sanctions, licenses, or license monitoring is you have some background screeners which have their homegrown system. So meaning they have their operations or verifications team going out and pulling those sanctions for them, going to certain sources like OIG, GSA, and taking that back. Or we do have some competitors like Verisys within the data space to where they go out and get those sources as well. But we were compared side by side with a lot of our competitors or homegrown systems, and we have multiple data tests and case studies. We came back with 40% more actionable data. So again, that gives you a more holistic picture when it comes to making hiring and firing decisions in real time. And to give a little quick, more granular case study, last year we were ran side by side with a very large government client, and their vendor had been in place for several years. When we were ran side by side with just our sanctions product, we came back with 40% more actionable data, and it's FCRA compliant. So it really helped them with being able to make decisions. The second box there that I wanted to go over, this is geared more towards our sanctions and our FACES product. So if you look at that holistically, we have over 3,500 sources that we are directly integrated with. So it goes beyond just that OIG GSA level. It goes to all the other primary sources when it comes to sanctions that we're integrated with. If you look at adding in the historicals that we have as well, it comes in with over 5,600 sources. So this is the largest and most comprehensive data set due to us being in business for over 30 years. And then to talk on the last square there, it really pertains to monitoring. So since we not only monitor individuals, we also monitor facilities as well. And we're constantly in real time monitoring over 30 million individuals and entities. So again, this is the largest healthcare population that's out there. It's real time, automated with alerts and notifications. So you'll have a change in status or you can monitor expirables as well. Over the next few slides that I'm going to go over, I'm going to break it out between licenses, between sanctions, and between monitoring. So this slide will go over license solutions. When you think about a license verification or different license solutions out there, there's different ones. So I'll do a little bit of education on it at first. When it comes to a license verification, you can run at point in time. So say you're with HireRight and you're running a healthcare background screening package. You can do a license verification. My name's Nicole Berryman. I'm going to apply as a nurse practitioner at University of Utah Healthcare. I go and apply as either part of credentialing or my criminal background screening package. My license that I currently have is RAN. That's a license verification. We also have the ability to say if a license comes back and it's not found, we can go the extra step to the primary source or all the other sources that we have to get that information. So you run that license as point in time, that's a license verification. And then after that, you can monitor it ongoing for changes, or you can monitor it for expirables as well. Some differentiators that I want to call out about Verisys's license solutions is that when we run a license verification or do license monitoring, it's all jurisdictions and all licenses. So all healthcare licenses, whether it be a veterinarian, whether it be a pharmacy technician, we have every single license in the United States and all jurisdictions that encompass it. And with our license verifications, we have a direct connection with the primary source that we're integrated with. So you're getting real-time updates. And the benefit of using us is since we have those integrations that we've built for over 30 years, there's no pass-through fees. And if you're looking at it comparative to whether it's a say your internal team is doing license verifications and they're going and pulling this information, or if you're looking at one of our competitors, the closest solution when it comes to automation and the amount of licenses that they're able to pull or monitor, the closest solution that's out there is only partial automation and partial licenses. And there are some solutions that say if a license comes back as not found, that puts it back on your team to have to go find it. Whereas Verisys, we don't do that. We verify everything. Something also that I wanted to talk about to add a little bit more granularity, which is also through HireRight's platform, is not only can you pull that one license point in time, but you can pull all licenses that are associated with a provider. So go back to my example of where I'm Nicole Berryman, I'm a nurse practitioner, I'm going to apply for University of Utah Health. Whenever I go to apply, whether I'm going through credentialing or the background screening process, I provide you my Utah license. I've lived in Utah for about 15 months. Well, if you're not mirroring the same scope that you have with a criminal background screening package, which Joe kind of touched on, to where you can go back and run a social security trace as a locator tool, a lot of the times your criminal background screening package is a 7-year scope or a 10-year scope. So you would want to mirror your healthcare screening in the same type of thing for risk mitigation. So if you would have looked at my criminal background screening package and said, hey, what other licenses does Nicole have or had back in the past 7 to 10 years, you would know that since I moved to Utah about 15 months ago, I also had a license in Nevada and I also had a license in Arizona. If you would have pulled all of those, you could have found out that my Arizona license was suspended because of elder abuse. And then my Nevada license that I had, there was alcohol abuse on it. So you would not be able to know about those other licenses unless you searched all of the licenses that was associated with that provider. And this is also something to call out. If you're in the behavioral health, mental health, telehealth, or pharmacy space, a lot of the times your providers operate in multiple states and see patients in multiple states. So there's a good chance that they have more than one license. And if you even look back to where when we had COVID, there's a lot of people that were being seen remotely or being prescribed medication in multiple states. So you would want to mitigate that risk, run not just that current license, but all licenses that that individual had as well. And something else to call out when it comes to licenses is that not only can you monitor that change in status, so whether you have a revocation, suspension, you can also monitor expirables as well. And those come with real-time alerts and notifications. And a good example of that, again, will refer back to me as being the nurse practitioner. With me being a nurse practitioner, say I have a compact nurse license, and that license covers 5 different states. If you're not monitoring that license, one of those states can drop to where it's down to just 4 states, and you wouldn't be notified unless you were monitoring that compact license ongoing. And to talk about this slide, it doesn't only relate to just licenses. It could go to monitoring and sanctions as well, but we'll focus on licenses for this example. If you look up at the top, there's the little papers with the magnifying glass. That represents our workflow to where we're directly integrated to the primary sources. So whether it's sanctions, licenses, we're directly integrated in real time. We then get that data and pull it down to where the V is right there. That's for Verisys. But not only are we getting this information from the primary sources, we're also getting it from where you see the doctor over there. That's our credentialing side of the business. So we're pulling from the primary sources, from our credentialing events, and compiling all of the information on sanctions and licenses on that provider. We then take that information and then we verify it. That's where that green check mark is. And then after we verify all the information, there's different ways that it can be sent out. We have our data in prescriber files, payment integrity, licensure. Pre-hire is where you would see our partner HireRight come in, to where they have their platform you would log into, and then we fulfill any of the sanctions or licensing or monitoring through that. And then our data, after you go through a credentialing or re-credentialing event, our data is then used in enrollment as well. And really, the reason why to show this slide is because you have to think about it. If you have a manual process on the back end, or if your team's going out and doing this, with the automation, with the workflow that we have in place, there's less human error, faster turnaround times, and you have more actionable data to make decisions on. And this slide right here is just to really talk about our FACES product, which is sanctions. FACES is a trademarked product from Verisys, and I'll do a little bit of education on the FACES product itself. So if you look when it comes to sanctions within the healthcare space, you have an OIG GSA search. Our FACES, we have 2 levels. We have the 1M. The 1M, the M after it, stands for meets Medicaid and Medicare requirements. So if you're billing Medicaid and Medicare, you want to run at least that. And then take it a step further, we have a FACES level 3. A lot of the healthcare industry is just checking the OIG GSA. The FACES 1M and 3 goes above and beyond that because we have the 5,600 primary sources that report into it. But just to talk a little bit on the difference between the FACES 1M and 3, because I get asked this a lot. Well, if I'm going to be running sanctions, which one should I run? The FACES 1M would be ran on your, say we'll refer to University of Utah Health, because I'm over here in Utah. You would say anyone that is a contractor, a vendor, a janitor, a pharmaceutical sales rep, you would want to run that FACES level 1M on them. When you would want to run a FACES level 3 would be any of your licensed individuals, because the differentiator between the 1M and the 3 is that you're pulling in board actions for licensed individuals. And with the FACES search, we can run at point in time. So say you're running a criminal background screening package through HireRight, you would see a sanction search in there. That's where a FACES product would be ran and verified. And then you can monitor it ongoing for any type of changes after that person passes their background check or passes their credentialing event and they're becoming an employee. So you can monitor it ongoing. And I just want to share one story that I had that I think is very relevant towards running a FACES. We had a client that had been using a background screener for a very long time. They ran an OIG GSA, so they weren't running the FACES at the time, but they ran an OIG GSA search as part of their criminal background screening package. Well, Verisys started working with them a couple of years later, and they took all of their population of all of their licensed individuals, and then they put them into FACES monitoring. Well, whenever we did the exercise with them, there were some things that came up that were not found before from their original background screening package. And what happened is they had to pull an employee in that had been there for a couple of years because when they ran a background check with just the OIG GSA, they missed a sanction. When we ran them through the monitoring that we do, we found that sanction. And then human resources had to pull them in. They had been an employee for a couple of years. It was a very uncomfortable situation. The employee had said, yep, I left that off. I didn't want to tell you about it. So it was a sad case of that employee had been there for a couple of years. They were terminated. But not only that, this hospital system had to pay fines back to the government because they had somebody working with them that were sanctioned. On my next slide here, I really want to be able to go over a little bit more on a granular level, how we search our information, how we verify our information, and how we monitor it. So if you look at the number one up there with our screen, our data is broken up into those 3 sets: data, verifications, and monitoring. And this can be any healthcare data set, whether it's sanctions, licenses, it could be any healthcare data set. And also, I like to point out that with that data, it can be run as part of a credentialing event, privileging, badging. It can be an onboarding as part of a criminal background check, monitoring, provider directory, enrollment, payment integrity, claims processing. There's a lot of different places that this real-time data can be used in. So say, for example, we'll refer to FACES. We're going to run a FACES search. We go out, pull our FACES information, bring it back. That's step number 1. Then we move into section number 2 right there is where we verify that information at the primary source. So say, for example, Nicole Berryman, we ran through our FACES search, came back, there's something that we needed to verify. We go then verify at that primary source, does this information belong to Nicole Berryman? We verify date of birth, social security number. There's other identifiers that we do with our matching logic to say, yep, this is something that's verified, we're going to report it out. So we search it, we verify it, and then you have the choice to to do the ongoing monitoring. So this is real-time monitoring. And you're really looking in FACES by itself, you would be looking for any type of changes. If you were monitoring licenses, we would monitor the license status and then also for any type of expirables at that 90-day mark, 60-day mark, 30-day mark, 7-day mark. And something that I like to call out, because I get asked this question a lot, Nicole, what is the difference between the monitoring frequencies? What is best practice? Well, if you look at and you compare solutions out there, again, you have background screeners, which do their own solution. You have our top competitors, which do their own as well. It's most common in the market to be able to see that this is done once a month. And really, it depends upon what do your contracts dictate, what does your compliance and legal team want you to be able to be processing. But there's a lot of individuals or organizations that do this once a month. Our monitoring is in real time, and that's because of this type of example. Say, for example, I am working for a healthcare system. I'm on their HR compliance team, and on the 5th of each month, I take all 8,000 of my people and I process them all in one batch, and it's done. After that, it's the 5th of the month. And then on the 5th of the next month, I'm going to do it again. Well, a lot of times, sanctions don't come in just once a month. They come in multiple days out of the month. So if you ran that on the 5th and all of a sudden a sanction came in on the 10th, what happens? You have that provider scheduling appointments, seeing patients, and then you have to bill for it. So what happens? You're not going to be able to, if that person is sanctioned, you're not going to be able to end up billing for it. So there's a lot that can be impacted if you're only processing your monitoring ongoing once a month versus in real time. And on this last slide right here, I just really wanted to tie it all together because we get asked a lot, well, how does this help us within healthcare? What are you doing out there? So for credentialing and healthcare clients, we follow NCQA, URAC, and Joint Commission. We are certified by NCQA and URAC because of our credentialing side. And really, we adhere to the Joint Commission. And recent changes within the past 6 to 9 months, this has been a hot topic about if you follow NCQA requirements and as a standard setting organization, you have to start monitoring your licenses. So we've been tapped on the shoulder, I would say a lot in the last 6 to 9 months about license monitoring. And really the second and third bullet kind of go together. So if you're using a partner like HireRight for background screening, you have the best-in-class healthcare background screening paired with the best-in-class healthcare data. So with that together, you're able to run sanctions, licenses, and monitor in real time because we're a fully integrated partner. So you won't even see Verisys on the back end doing all the fulfilling. You only interact with the HireRight platform. And really where that comes into place is consolidation. So think about it this way. I'll refer back to Intermountain Health again because I'm in Utah and I actually use them. So with Intermountain Health, they're a very, very large healthcare organization and they have a lot of different departments. So if you look at it, typically for background screening, you're within human resources and talent acquisition. Well, you have a whole nother team that works on credentialing, medical staff services. They handle the healthcare data that they need as well. With how large Intermountain Healthcare is, you would see that they also have a health plan, and then they also have pharmacies in each one of their locations. So you have to think about it. The same healthcare data is being used by all these different departments. So if you have a partner like HireRight, they can be that one consolidated platform with all of the healthcare data pumping in behind it. So it will help with consolidation of platforms, consolidation of vendors, and that way you can get that enterprise solution across all these different departments, and it helps you cut costs and reduce risks. And Joe, I'm going to hand it over to you.
All right, perfect. Thank you, Nicole. Super informative, really helpful to kind of walk through all the different steps that Verisys gets involved in, how integrated you are with the data, and really great kind of close out there, just tying it all back to you can have all of that through a single platform with HireRight. All of your pre-hire, all of your post-hire can be accessed through a single portal. And the next piece here we're going to talk about is some of the other products that we offer that are going to help detect fraud and verify the credentials that these folks need as they come into your organization. So first off, the different verifications, licenses and certifications really fall into what Nicole was talking about with the licenses and the license complete product that she was referencing regarding the ability to go out and not just search for the license that the person provided, but pull in all of the other licenses that they hold that they may not have disclosed because they did have a sanction or an action on that license. So to kind of go back to the top here, earlier we did talk about the identity fraud and ways to detect it. Now we're going to talk about some other areas where that fraud can come up, and that includes the education and employment history. And you may be offering the person the position because of that education and employment. They may not qualify for the role you're filling if they don't have 5 years of experience as an RN. So you want to make sure that you are verifying that correctly with the original source. So first off, the vendor you work with, you want to make sure they have quality first verification methods, not just speed to get it done, whether they get the results or not, but really focusing on that quality. And one of the great benefits we have here at HireRight is we actually have a specialized team based here in the US that is focused solely on healthcare verifications. They do the employment, they do the education, they go directly to the original source. And because they work in that space, they understand the difference between an RN1 and RN2. They can understand and translate some of that terminology or the abbreviations that candidates will put in so that you're not dealing with folks who don't understand the landscape and having to go back and forth and saying, hey, that's actually the same exact thing. We have folks who know what they're doing and have that experience. The next thing is the CV analysis or resume analysis. What this does is allows us to take the CV or resume that was uploaded either into the ATS before you place the order and it populated over, or if you're using our system directly, you upload it, and we will indicate and flag if there are any discrepancies between what was provided originally as part of that application with the resume and what comes back on that background check. So if they said, I have 5 years of experience working at Intermountain Health, but during that time they actually hopped around and maybe they weren't even in the healthcare space, but you're hiring based on that, you're going to want to know that discrepancy because if all we have is what the candidate provides us, and we go through those 5 different areas in 5 years, and it all checks out based on what they provided, we're going to give you a clean report because that's what we have. But if we're able to map over that CV, that resume, we can compare that and make sure that what they told you is the same thing they're telling us, and that we can make sure there's that any changes are tracked on that and you are flagged and notified of those. With the employment verifications, the other thing that you want to make sure we're doing there is similar to the license complete. There is an ability for clients to request all employment history that someone has through some of those third-party databases that we're able to access. So maybe they left out an employer, they said they just had a gap, but in reality, they worked somewhere and they got terminated. They don't want you to know about that. But if that employer reports into one of these databases, we are able to pull out, hey, they did actually have employment during this period that they said they didn't, or they had a gap. So using some of those tools to make sure that you're getting the full picture of their employment, their education, their licenses, really helps to identify that fraud and potential omissions and make sure that the people you're bringing in have the credentials that you need. Nicole, is there anything else you wanted to add on that License Complete product? I know you covered it pretty well earlier, but as I go to the next slide, anything else you need there?
No, I think you did great. Thank you.
Perfect. All right. And the last piece here, really kind of tying back to the end of Nicole's presentation, is some best practices for post-hire monitoring and rescreening. So really within HireRight, there's 4 buckets. A couple of these could be split out if you really want to get into the weeds, but there's 4 buckets of monitoring or rescreening that organizations can do. We talked about healthcare sanctions. Nicole went over that really well, but that's something kind of base level in healthcare you've got to do at least monthly. Some of these items, especially as you go into licenses and certifications, you need to be monitoring those consistently. Some other items in the bottom 2 there, criminal arrest records and driving records, aren't as common, at least historically in healthcare, but the more that people are able to move around, the more that healthcare organizations are working with patients and going to their homes and providing mobile care operations, you do want to make sure that you are including driving monitoring to be identified of any incidents that happen on the road. Because if someone is driving on company time, obviously that is a liability to the organization. If they're going to patients' homes, if they're providing transportation, you want to make sure that you know what's going on and help protect those operations. So you don't need to monitor everyone, but anyone who is driving, you're going to want to make sure you include that. And then criminal and arrest records, like sanctions, you want to make sure that if something happens, you are identifying that and helping to protect not only the workplace, but of course your patients and your brand reputation. So those are the items here that you're going to want to make sure that you consider as part of that post-hire screening program. And that's yeah, that would be all I have on that piece. That wraps up the presentation here for today. We are going to go into the Q&A section here. So let me get that slide up and see if we have any questions.
Joe, can I add something to the last slide that you had?
Sure, absolutely.
Okay, I just wanted to add in there, we went over a little bit over the slides that I had addressed, but also so important when it comes to sanctions, the license and certifications and arrest records, it goes back to, yes, people go through criminal background screening packages, point in time. We're pulling this information. Are they good? Are they not good? Do they pass or do they not pass? Well, what you have to think about is what about potential pending charges, whether they're criminal charges, whether they're sanction charges, whether a board certified physician got a DUI and they're just going through the disciplinary actions because maybe they appealed it. Us abiding by the FCRA, we do not report pending charges. It's just convictions. So that's why it's so important to do post-hire monitoring, whether it be criminal sanctions, licenses, to be able to say, hey, since we hired you, were there any changes in status? Did you have any pending charges related to criminal or healthcare that we can then report? That's all I wanted to add.
All right. Perfect. Thank you, Nicole. And I'm looking at some of these questions we have here. And just looking at the timestamps, I think a lot of them, Nicole, came in during your presentation there. So I think the first one here, just do you have dental practices as customers? I would assume the answer is yes.
Yes.
All right. And the other one that I think, a couple of them, I think we can follow up with those folks directly. But the fourth one we had in here about having their SSN to use that license complete, where you're pulling in all the licenses. Do you need the social security number for that, or can you use a different kind of identifier?
Yeah, there's different type of identifiers. That's a really great question. And it goes back into what I had explained. Do you want us just to go search the license? If we just go out and search the license, we can use a license number or we can use an NPI. If you're wanting to do a verification of saying, hey, let's use the matching logic, does this license belong to this individual? We would prefer to have either a social security number, date of birth, an NPI, some other type of identifier besides just the first name, last name, license number. Because if you think about it, it's the same thing as a criminal record. When you're going out and you're saying, hey, go search Nicole Berryman. Great, there's probably a million Nicole Berrymans in the world. There's a lot. So you have to have those additional identifiers, whether it be a social, a date of birth, an NPI, whatever you need to be able to tie, hey, is this verification, does it belong to that individual? So no, a social security number is not mandatory. There are other identifiers that we can use, just like with background screening.
All right, perfect. Okay. Any other questions coming in? Don't see any others. All right. Well, thank you everyone for joining today. It was great to be able to share some information on, healthcare screening and really what you want to make sure you're focusing on as you move into the second half of this year and ongoing as you evaluate your screening program. If any other questions do come up, please feel free to reach out to HireRight. If you are a client, reach out to your account manager or your customer care team, and we'll be sure to get those answers back to you. But we will go ahead and wrap up the webinar here. Keep an eye in your inboxes for a link that will be sent out tomorrow, and we look forward to seeing you on the next one. Have a great day.